Good morning. I am Dr. Umesh Bilewar, consultant dermatologist and hair transplant surgeon from Ozone Care Clinic. Today we will be talking about hair transplant. We will be taking various questions surrounding this wonderful procedure. The first thing is basically what is hair transplant? Hair transplant is basically a procedure where we are taking hair roots from a donor area, that is the area where we don't lose hair normally. In simple words, it's a area where loss of hair is not there because the hormone which is causing hair fall in the frontal aspect is not acting on donor area because of genetic predisposition. So what we do, we utilize this property of genetics or to our advantage, and we use those genetically better hair to be implanted in the bald area. Okay, so basically this is transplanting hair from donor area to recipient area to give us a natural result. This is an interesting question, that how does a hair transplant work? As I already mentioned, that hair transplant work by the principle of donor dominance, means the hair roots which are present in a donor area, or you can say occipital area of our scalp, are dominant. They are basically, they are not they are dominant on what? They are dominant over action of DST. Basically DST or dihydrotestosterone is a hormone which consumes our hair in the frontal aspect of the scalp. It acts by reducing the blood supply in the frontal aspect of the scalp gradually over a period of time. It causes hair to go miniaturized, and because of that there is loss of hair in a progressive manner. The loss of hair, it depends on what kind of progression is there. In some individuals it's very early, it depends on genetics, your tendency to hair loss, and in some patients it is gradually, or some people may experience it very late also, but most of the males as well as females have that phenomena active in them. Obviously the severity depends on every individual. Now the hair transplant, we take hair roots from donor area, or where DST is not acting on the roots genetically, and we implant those hair roots in the recipient area or the frontal aspect, and that way the hair roots grow. So it's like any other body parts, it is accepted, like body will accept its own things actually, and because of this we hair transplant works. It is like planting one tree from one place to other place. Similar phenomena can be utilized in your own body as well. This is a very important question, that who is suitable for doing an hair transplant. Basically roughly there are three criteria. First is age. As far as our experience in Ozone Care is concerned, we don't consider people below age of 25 years for hair transplant, because in these patients the action of DST is unpredictable, it is highly active, and because of that we can experience an aggressive hair loss. Even after doing hair transplant also, the DST or dihydrotestosterone can act on the transplanted hair as well, because of which we can experience hair loss in transplanted hair, or probably the transplanted hair can stay there for a lesser amount of time. The hair transplant might not last long. So age is a very important factor. To be precise, below 25 no hair transplant. 25 to 30 is depends on the genetic history and tendency of patient, what kind of severity or what kind of progression is there, and above 30 is the safest age where we can do hair transplant. Then second thing which is very important for considering hair transplant is the grade of hair transplant. Some people may have initial grade of hair transplant, some people may have higher grade of transplant. So depending upon that, and depending upon your available donor, we take a call about hair transplant. Third thing which is very important is kind of donor area you have. Some people have a donor area where miniaturization is prominently present, so we have to make sure that quality of donor area is very good. If quality of donor area is good, your hair transplant will be good actually. So these three things, like the age criteria, the kind of baldness is there, and the donor area, the quality of donor area, these things are very important for considering a hair transplant. Thank you.